Good day, everyone. Welcome wherever you are in the Philippines and around the world. This is the Public Sector Productivity Webisodes. My name is Gerard Calambro and I will be your moderator for this webinar today. Before we start, I would like to give a warm shout out to all of our viewers from the following agencies in the Philippines, such as the AFP Procurement Service, the Philippine Drug Enforcement Agency, the National Security Council, the Philippine Heart Center, the Mindanilla Municipal Jail, Davao Oriental State University. We also have the Bureau of Jail Management and Penology, and the National Police Commission here in the central office in Quezon City. So good afternoon to everyone. Thank you for joining us again. On our webinar yesterday, we have learned that to be able to achieve total quality management and business excellence in the public sector, we should know and practice that first, there is an overarching tools and frameworks on quality. Second, we should have hands-on leaders and empowered people in order for us to make a difference. Third one, business excellence is not just an award, but rather it's a journey of building a competitive nation. Fourth, we should always be open-minded and we could check out new ideas and keep on innovating. And lastly, improvement and excellence should always start not just with the government, but with us, with ourselves. So with that, on our third day this afternoon, we will have an actual example. Our guest will tackle the promotion of quality and performance excellence in the public sector. With that being said, I would like to introduce our expert for today. Our speaker is a specialist in diagnosing and treating heart problems in children. She obtained her bachelor's degree in biology at the University of the Philippines, College of Baguio. She also obtained her master's degree in science and public health and doctorate degree in medicine at the University of the East Ramon Magsaysay Memorial Medical Center. She was awarded a notable award, Dangal ng Bayan, in 2021 by the Philippine Heart Center. And aside from being affiliated with the Philippine Heart Center, she is also a member and a fellow in the Philippine Society of Pediatric Cardiology, Philippine Heart Association, the Philippine Society of Echocardiography, the World Society of Congenital Heart Disease, and the Institute of Solidarity in Asia and Children's Heart Foundation. She is now the Department Manager of the Pediatric Cardiology and Management Services Department in the Philippine Heart Center. Let us all welcome Dr. Juliet Balderas. Good afternoon, ma'am, and welcome to our webinar.
Good afternoon to everybody. This is the third day today for productivity session with the Development Academy of the Philippines. Today, I would like to talk on the promotion of quality and performance excellence to withstand the global pandemic for the Philippine Heart Center experience. My speaking objectives is to present the Philippine Heart Center best practices, the efforts to flatten the curve since the COVID-19 pandemic started in March of 2020 to present up to now, to present the quality journey of the Philippine Heart Center to withstand the pandemic towards the new normal, and to reiterate that despite the COVID-19 pandemic, governance and excellence in quality improvements should continue. The Philippine Heart Center is a 532-bed capacity cardiovascular specialty hospital and remains to be the national referral center in the country with 2,800 employees. So the workforce, we just had a DBM approved 2,303 plantilla after a restructuring which was done for 500 contractual COS in the last of 10 years. So this is the Philippine Heart Center. It shows us that our strength, if this heart center is actually made of 4 petals, which centers on the 4 objectives: patient care, education and training, research, and public information. We are mainly a vascular center, intervention center. We have a very strong vascular and intervention departments. We have a very strong cardiovascular surgery department in all its subspecialties, a cardiovascular radio unit, a cardiovascular lab, and non-invasive lab. We have 3D machines, about 20 20 of them. So which shows that the Philippine Heart Center continues to commit into the subspecialties of learning how to take care of at best of the cardiovascular problems in the country. We have mentioned earlier that to be the excellent and improvement in quality, it does not happen overnight. So continuing quality improvement for the Philippine Heart Center really dates back in 2010. So if we think that inisip namin nun, paano matatalo ba tayo ng COVID? Sabi natin yung quality when it happened in March of 2020, I thought, ano pa ba ang gagawin natin? Will everything vanish suddenly because there's increasing mortality? Wala nang pumapasok. But we should look back. Our history of quality is stronger than COVID. If we look back at the history in 10 years, we have improved ourselves so much that probably what we evolved over the years could be something that we can use productively against COVID. So the quality journey of the Philippine Heart Center started in 2010. Initially, when the PhilHealth said that they had a bench book for Center of Excellence, and the Philippine Heart Center was awarded the PhilHealth Center of Excellence in 2010. To improve our hospital processes, we had an international accreditation, the Accreditation Canada International, and we underwent 3 reaccreditations in 2011, in 2014, and in 2018, and now in 2021 we are now undergoing our 4th cycle of Accreditation Canada. Accreditation Canada is really meant for improving hospital processes on the required organizational practices for taking care of patients and employees. Then in 2013, we looked into our performance governance system. We had an initiation and we went through the 4 stages of PGS from initiation, and we were institutionalized in 2018. And we were awarded the Islands of Good Governance in 2015. So this is the vision of the Philippine Heart Center, to be the leader in upholding the highest standards of cardiovascular care, a self-reliant institution responsive to the needs of the Filipino people. We have our mission to provide comprehensive cardiovascular care enhanced by education that is accessible to all. So now the Philippine Heart Center provides education to all cardiovascular specialties in the country, and that is the basis why we now have regional heart center development to develop 1 regional heart hospital, one at a time, in all the 17 regions in the country. At that time, we thought, what are our strongest capacity? We have to focus effort on taking care of patients, but it should not stop at patient care. We have to have an advocacy. And what best is the advocacy of Heart Center is to prevent congenital or cardiovascular heart disease in the country. Cardiovascular disease remains to be the top mortality in the country. So, prevention should be the leader. Aralin natin what are the most important problems and how can we direct policies in the country to prevent cardiovascular disease and reverse heart attack to become preventive in nature rather than a curative in nature. So, patient care, not just a leader in cardiovascular care in the Philippines, but how do we benchmark with other countries? Do we have improved outcomes because of improved management, or to come up with the best and advanced modalities competitively with countries in Asia and the world? So this is the strategy map which we had in 2016 to 2022 when we said that we should improve in patient care and advocacy. A strategy map is actually your summary of objectives, what you like to achieve in the 5 or 6 years or up to 10 years. It is very important. It stresses, number 1 is your goal. Number 2, what you like to achieve or your strategic position, to be the leader in cardiovascular care at par with global standards, and to be the leader in advocacy of preventive measures and policies. And it centers also our 4 petals. Our core process would be taking care of patients, education, research, because evidence-based policies is important in heart care, and advocacies. And these are based on hospital processes or hospital support based on your people or improvement of the people or your HR. Increase access to cardiovascular care. What is your reach in the advocacy? How do you upgrade hospital processes? How do you look for or your streamline procurement and provide technology based on what funds are available, both from the government and prudent use of funds? So this is our strategy map at the time. Going through the levels of PGS, we were awarded as the Island of Good Governance together with other 12 agencies in the country during the APIC Summit. When you say you are recognized for good governance, it means that you have achieved your strategy map over 3 years. You have become cascaded your strategy map. There is compliance and you have seen breakthrough results. So at the time, you also said that Philippine Heart Center will be the leader and create regional heart hospitals. So this was at that point in 2015, we were able to set up already 5 regional hospitals. So during the pandemic, dapat hindi tayo nawawala. Let's go back to our core. And for the Philippine Heart Center, our core is patient-focused care, compassion, integrity, respect, and excellence. So that amidst the COVID crisis, and this was the worst challenge of the century for international health and financial systems. And nobody was really prepared for it. Almost after a year, by April 2021, 152 million were already affected, with 129 million recovering. But it did not stop there. After a research by October of 2014, which is almost 6 months after, because of the two surge, there is 57% increase in number of people affected and 68% who has recovered. So how did we do this? And in the Philippines, if we review, nakakaroon na tayo ng dalawang surge, di ba? In April 2021, we had the March surge, wherein we had an increased number of cases. And then recently, meron na naman tayong second surge, almost after the April, we now have the second surge last week, August, wherein the highest was in September 2021. So each time that the surge develops, we have to go back to our core. We have to go back to our processes. Paano nakaka-recover ang heart center? So we also have an internal monitoring of our COVID pandemic. We also went, talagang merong surge at that time. You had the first surge in March or April. So kahit naka-recover na yung heart center after March and May second surge. And now we again had a second surge, which is equivalent to what the country was having. But despite that, we were able to go back to our mandate of taking care of patients with heart disease, being able to come back despite the pandemic. We went back in June. Then at each time we had a lockdown. But from January to August of 2021, we are now back to about 4 to 6 surgeries a day and 50% of our procedures at the cath lab. Since January of 2021, we had now done about 1,600 cases. We have done 1,896 angiograms and 963 PCIs. This is nothing compared to what we usually do. Pre-pandemic, we used to do about 11 to 12 surgeries a day and 20 to 30 angiograms per day. But slowly and surely, despite the pandemic, there are almost about 6,000 to 7,000 cases a day from September of about 20,000 per day. So we hope to be able to come back to at least 75% of our usual census to take care of more patients with heart disease. How did we do this? Making breakthroughs. What is our goal? To protect our patients and employees. So we had safety measures against the COVID pandemic. We had monitoring of the number of staff who had COVID, and each time we need to monitor or how many staff are affected and implement a strict mandatory protection or against COVID for all the staff. So here we see the two surges. How did it affect our staff? This is the first surge, and in April or March, this was the highest surge. So totoong nagka-surge at that time. But if we note here, the second surge was really due to community transmission than a patient transmission, which means that the infection was contained in the hospital. However, when the healthcare workers go outside, then community surges occur. Immediately before in June, there was already a decrease in number of COVID. However, now, during the surge, there's an increased number of COVID patients, 62. However, slowly, we hope to decrease this with the 6,000 to 7,000 cases per day. So one of the best practice that we had when COVID first attacked the country in March, was to set up a management of the event incident command post. We have an incident command system. We have an incident commander. This is our structure, which has extended up to now. There's an incident commander. They have a liaison officer officer, a public information officer, and each of the hospital support was divided into operations, planning, logistics, and administration. So we had meetings once a month to discuss all the operations in the hospital. So there's a one central command regarding supplies, disbursement of supplies, and most importantly is meetings, multidisciplinary daily meetings so that the problems are really attacked as they happen. This is a function of quality. When you have an organization, functioning of quality means everything should be written by ISO standards. So when we got back to work, there was change of policies was implemented in all areas. Policy for admission, policy for cohorting of COVID and non-COVID so that hospital services can resume without increasing transmission among healthcare workers and assure that patients are safe within the hospital. There were a total of a lot of policies which are clearly available intranet so that all the patients or the staff can easily access to the policies which developed by the incident command post in all the services. We also developed a safety officers. There is a strict implementation of the safety policies within the hospitals. So safety officer is in charge of communicating what is transpired in the ICP, compliance enforcer of hand washing, distancing. This is also the coordinator between the employee and the ICP. And when there is mental health or one is distressed about increasing transmission within the family or within the unit, then the safety officer also acts as a counselor. She is the navigator and the coordinator between our mental health implementer or the psych to the employees. Increase in the compliance to safety protocols are very important. So the safety officer monitors and submits to the incident command post and the infectious service the compliance monitoring of all the members in the hospital. Testing was also very important. Testing for healthcare workers when they are assigned to the COVID units is every 15 days. Testing was also done to the non-COVID, 50 tests per day, and it should be based on evidence. So we had change in policies depending on DOH policy. So anytime at the ER, the best time to test the patients is at day 5 of symptoms or day 5 of quarantine. We had a gene experts to check right away whether to decide to isolate the patient or isolate the employee or just quarantine the patient. We also have safety book. There were a safety officer book wherein it implemented the ICP policies on healthcare workers. What to do when they have signs and symptoms, what to do when they are returned for work, and what to do to take care of their contacts. You have a high risk and a low risk exposure. So daily symptom monitoring, twice a day of temperature, and all the employees are asked to have a healthcare declaration every 14 days regarding the presence and absence of signs and symptoms related to COVID. So COVID testing was immediately done to isolate those who are infected. We had a molecular diagnostic lab so that the results are available within the day. This is important to admit patients who are for pre-operation, for ICU admission, to detect all ER admissions so that all patients should have a COVID test to determine kung anong ward sila naka-assign since we have COVID and non-COVID wards. Those who have healthcare workers suspected of clustering, we know clustering if there are 2 to 3 healthcare workers affected in one unit. For procedures outside PHC, and subject of availability of cartridges. Because of the best practice, our molecular lab has now increased to 2 machines so that we can do about 30 cases at a time. But COVID is just COVID. When you say it's just COVID, mabilis siya mamatay. But come to think of it, the census of death due to COVID is just 4.9%. Many still die of heart disease. So in 2020, 4.9% COVID-related deaths versus 17.3% heart disease-related deaths, which is an increase from 2.3% increase from the average death of 82,547 to 99,000 in 2020, which means we should not be caught by COVID. We have to remember what is really our mandate is to take care of children or Filipinos with heart disease. So we slowly resumed our activities in June of 2020 and to a target number of cases of 6 per day versus decrease in 15% of our pre-COVID. But there has to be a way of moving forward. We had have to resume our elective surgery. And to resume elective surgery, there has to be a mandate of a strict compliance to revised policies from admission to surgery. So that if a patient is positive for surgery, surgery is deferred previously for 21 days, but because of the Delta virus, it is now deferred up to 4 to 7 weeks. So elective cases must be confirmed negative to protect both the doctor, the healthcare workers, and of course also the patient, since they may have poor or high morbidity when they are COVID positive. There is also resumption of outpatient clinics with revised rules. And what are those revised rules? They have to pass through a triage to determine, number one, if they have health declaration or signs and symptoms all related to COVID. So if they have signs and symptoms related to COVID against transmission, again, they have to be directed at ER or a pulmo lab. We can also direct the patients that they cannot enter COVID areas, and more importantly, to control the flow of patients at the clinic. So very important for COVID, it has to be every 15 minutes to prevent transmission. So sa isang oras, the doctors have to see only 4 patients a day. So controlling the flow of patient into the doctor's clinic will also protect the doctor and the people in the waiting room. So now we have 90% of doctors who have gone back to the clinic, and after again the surge this August, we have resumed clinic in the OPD with increasing number of patients. So the QMS journey of the Philippine Heart Center started in 2013 when we had developmental challenges, the competition from cardiac centers both locally and internationally, and we are challenged to remain the best heart hospital. Competition from standalone diagnostic centers, like example in our laboratory, there are about 3 to 5 laboratory outside. Ang pinakamataas kasing kita ngayon sa cardiac is echocardiogram. Almost all patients will need echocardiogram. Pag may high blood ka, may chest pain ka, they will all need an echocardiogram. Next is standard and even reduced government subsidy. So at that time in 2011, the government said maraming kita ang heart center so we can cut on the cost. So ang previous budget, example 200, it was cut to about 50%. 100,000. But you know that one heart surgery, the budget of the heart center from the government is solely for the care of the patients. So cutting the cost to treat more became a challenge. And of course, to develop a research agenda which can be translated to patient care. So review in medicine, you keep on reviewing your processes. You keep on reviewing treatment towards improvement or towards better improvement or towards treating more. And that is what makes researches in medicine. So the QMS journey, you do not forget the quality assurance goals. Reorganize and revitalizing in 2006, initiate high visibility and impact projects, expand CQI to all levels from management to frontline providers, and ensure compliance with national and international healthcare standards. And this has been the basis in 2006 to completely improve or continuously improve inpatient care by going through all the accreditation. The most important in quality is the PDCA. You have to plan, to implement, and monitor what is your corrective action and make a recommendation depending upon the effect of what you have implemented. There should be a no blame policy. When you see one speaks up, it is always for the good or for the improvement of all, whatever happened, of whatever outcome that happened to the patient. And that is embracing the maxims of quality circles assures everyone that we are together towards improvement in our systems all over the hospital. We also went through the strategy of performance governance system. So when there was little budget for the heart center, how do we go towards development? Walang budget. We only know that we have to remain the best heart hospital and we are the heart hospital referral center. And our only strategy was to improve the performance. So performance governance system is performance monitoring despite COVID as a PHC culture. So this happened in 2011. So the only way is ito ang natatandaan natin pwedeng gawin. Re-implement whatever we learned before. So even if this started in 2013 when COVID attacked us, then we go back. Let us restructure. How do we improve despite COVID? By using the same formula of identify vision and improving performance. Accreditation Canada is improvement in quality healthcare. This is more for clinical excellence and good governance. So in 2014, we have a gold and diamond. And the basis for this is going through required organization practices, how to prevent errors in medication, errors in choosing the patient, identifying the patient for the right procedure, errors in use of equipment, errors in procedure, and this is very important for hospital and development and patient care. So we initially had a gold and went to diamond, and now we are in our fourth cycle for reaccreditation. We went through ISO in 2018. ISO naman is cleaning up the papers. Whatever is written that is not written does not exist. So everything that is written becomes a policy and should be followed by everyone. So ISO helped us clean our papers. And having gone through all the accreditation made us sure that maybe we are ready for the Philippine Quality Awards. In quality policy, the Philippine Heart Center commits to have the highest standard in cardiovascular care, imply or all the relevant statutory and regulatory requirements, and to completely improve our processes. And in our lobby, you see our mission, vision, and our quality policy so that it is embedded in all the members. The ISO should not just be a compliance. It taught us to have a risk management is essential for a successful day-to-day strategic management during the turbulent COVID pandemic. Quality management system was harnessed to help attain the goals and aspiration of the Philippine Heart Center. So increase access to cardiovascular care or over the country, we again implemented. So when COVID was born in March of 2020, so sabi namin anong gagawin natin. So we went back to our old learnings, and the old learning is to prepare scoreboards despite the pandemic. And what is a scoreboard? In a scoreboard, you have a goal per unit, but the most important is measuring the performance. And this is presented in a managed review of operations quarterly to check the performance of all the units. Each of the unit were asked to make unit scoreboard as a way of sustaining excellence. This is an execution mechanism to enlighten everybody to increase performance and produce breakthrough results. What is the basis of this? Dapat may isa 1 to 3 goals ka so that you are able to achieve the goal. But if you have a lot of goals, like sabi, what are your quality policies and quality objective? Dapat isa lang. Because if you have a lot of goals, hindi mo na-achieve. So what we did is to make a breakthrough per unit and became their quality objective and expect them to attain their quality objective by performance monitoring. So we had an institution goal, the increased number of patients, all production and all patients are decreased. So when you look our financial monitoring, negative siya lahat. So how will we increase the number of patients served despite COVID pandemic? And you have to fall within the standards of safety. And number 2, how do you protect the patient and employee as a COVID-19 pandemic response? So again, by memory, dapat i-apply namin lahat. Institution had the same goal. We had 52 units, all were asked to develop 2 breakthroughs, one related to improvement for the whole institution and one related to safety. So at the end, all the units, we have 4 services and all the services developed 112 breakthroughs, which was monitored by our Office of Strategy Management. This is a sample unit breakthrough will contain a target, increased number from 6.7 to 6.04, and a fixed time at which it is attained. Then you have a lead measure. The lead measure is what is the action of the unit to be able to reach the objective. So action plan is set by members and compliance to the plan should be directly or indirectly move the targets without looking at the targets. So breakthrough targets, so these are monitored by the different units. They see to it quarterly or monthly that the target is attained. If the target is attained, then there should be a corrective action report or an initiative is developed. So in the 2021 scoreboards, we also developed a hospital safety management team. The hospital safety management or safe culture management will take care of the hospital safety scoreboard. So we want to decrease the number of patients or COVID incidences, number of health workers who are diagnosed with by 50%, and decrease patient safety incidences from 3.2 to 2%, like burns, wrong medication errors, and this was done by computer encoding. So during the COVID, what are our sample breakthroughs? Example in social service division, how do they increase the number of patients served is through remote model consults. So remote model consults or clearance from 0 to 50% was introduced. How about for telemedicine? Telemedicine was also instituted in our units so that instead of looking at the patients, increased patient safety now shifted to appointment-based consultation and lined up by 80%. So these were monitored. We had a new patient safety unit, and the patient safety reports were divided into those related to patient care, those related to systems and processes, facilities and resources, and those related to employees. And by monitoring of the dashboard, everything, the compliance was more than 130%. And by civil service, any compliance more than 130% is outstanding. So the outstanding compliance should translate to results. These were ranked from highest to lowest. We encouraged at the end of the breakthrough, 70% had 100% breakthrough accomplishment. And we encourage them by giving awards. This year, during the Safe Hospital Week last September, all the units were ranked and we gave them a gold patient safety warrior, bronze, and silver patient safety warrior to encourage the units to continue on being safe or implementing COVID safety measures. We also shared our safety protocols in a hospital safety program or summit, focusing on how to communicate with patients, how to clean up our files, how to discharge patients, and how to disclose and related to COVID pandemic. And in this sharing, there were a total of 785 attendees with 334 hospitals. The monitoring of the balance scorecard or strategy map in 2020 shows that kahit na nag-negative kami, after we instituted from July and went back to our scoreboard, we were able to recover the negatives and still have 127 or very satisfactory accomplishment. This will show you the heart center recovery after the reset of the scoreboards. Ito po yung time namin ng COVID. So we were able to recover, percentage increase by 43%, increase from until June. So we were able to, although it is still not comparable with the pre-pandemic reports. The Philippine Quality Award, we applied for Philippine Quality Awards in 2018 and we were awarded in 2019 and we had a Mastery in Quality Management Level 3, the only government agency with the highest level. And I think what helped us go through this, it is not magic. We had to apply 10 years of quality from PhilHealth, PGS, ISO, and ACI, and we were awarded the PQA as master in December of 2019. So what is the Philippine Quality Awards? This is the new Philippine Quality Award which is applied to hospitals. So you have your core values and concepts and you have an organizational profile. You should have a strong leadership, you have a strategy and customer, and it should apply to your workforce and your operations. It should be reflected and produce results. So if you apply in PQA, all of these areas are studied. How is your leadership? Do you have a strategy? Are your customers happy? Do you measure and analyze your results? How are your people and implementation? How do you develop results? And are there breakthrough results? This helped us in mastery because it was already innate for us to measure our objectives, and the breakthrough of each unit was very helpful to show that there is strict monitoring of results within the organization. So when you say strategic initiatives implementation, it was translated na iba po yung PQA. There is now a PQA related to hospitals so that you have strategic implementation. Customer is now patient engagement. There's internal audit, human resource, and operations which are relative to effective healthcare service and work processes. So we were the first who used that. Previous to this, you will go through a self-assessment pretest, and we were sponsored by DBM. The DBM sponsored a lot of organizations to go through the self-assessment. And after we had the self-assessment in 2016, our overall score was 603. pwedeng mataas ang pangarap namin, but it gave us confidence to go to the next steps of PQA. Ang PQA po is, I think, the most difficult of the all accreditations, most strict of all accreditations from preparation. You have to undergo a class after the assessment. You undergo through a class on how to construct, how to pass, how to make the manuscript. And this is our self-assessment. They also tell you kung ano pa ang kulang mo. So if this is your self-assessment, how many points more ang kukunin mo to be able to attain the 4 and 5? I have noticed that it does not stop us nandyan sa inyo. It's embedded. What is important is you should assess. So yun po ang 4. And number 5, you will have to keep on improving. So if the assessment and improvement is embedded, then there's a chance that you will get a higher score of 4 or 5. From the self-assessment that we had, makikita mo doon what are the initiatives that you should do to implement or to improve. So I think the assessment portion is very important to develop the action plan. And the action plan from our self-assessment in 2016 was expansion of the clinical pathways. These are fixed care pathways. And if you have fixed care pathways, then it will help you improve the outcome of the patients. Pag red yan, ibig sabihin, there is direct relationship of the initiative with the scoreboard. Expand wellness, PHC care, continue in-house to be able to cater to more charity patients. We continued the satellite hospitals. We have a telecare and we have a safe hospital policy. So this is drafted in 2016. And now we can say that it is effective. We have implemented all of these 5, even if at the time it was just a plan. Here, increased internal and external communication. We now have an internal external audit group for the ISO, which continues to monitor all the units in terms of implementation. Quality improvement in all these stages happened kahit na ang plano namin 2017. All of this happened, and the sustenance of governance excellence happened even if it were just a plan after the self-assessment which DAP gave us. So, the prerequisite for PQA application is a training of your team and a self-assessment. And for us, I think what was most productive, even if we did not go through, kung sample naghinto kami, hindi na namin itutuloy, was the self-assessment phase. Now, looking back after the self-assessment, kung anong plinano namin really happened for the hospital after 5 years, making us confident to say that we can go through a next level for quality. The PQA assessment, you have an independent review after submitting your manuscript. The manuscript is very strict in terms of number of words and number of form. You have to learn how to construct also your answers. There are 3 steps of initial consensus planning, meetings before they go for a site visit. And then there's a final judges review before you go through awards and recognition. After we had our PQA, we were graded as master. And if you note, hindi pa siya perfect. There's always, we say that perfection is a work in progress in the Philippine Quality Awards. So if you note, akala mo mataas na kami, no, we are on the 3rd level, but it's just a 50 to 55% or 60% improvement. And probably, as I was saying, it does not stop at being 3. The PQA assessment is 1 to 5. 3 is just having it. So improvement is number 4 and 5. Number 4 is assessing. You have to have proof that what you did was equally assessed. And you have to prove that what you assess or the action plan has been implemented and has been assessed. Like, it seems grandiose to have strategic satellite hospitals. Akala mo, okay na. But what was asked from us is, do you have monitoring that your regional hospitals is effective both for the patient and the institution? So, moving forward, wala kami nun. But definitely our strength is a visionary leadership. Going through all these processes means that somebody has to know that it will be good for us. And even if it was not good for us, there was a milestone which was achieved, whatever the outcome. But despite the outcome, there is continuous desire to continuously improve, not for ourselves, but for our patients and our employees. There is customer-focused excellence in the institution. It showed us our strength, that our strategic initiative optimizes impact on the whole society, especially with regional hospitals, and the lead in the advocate of heart disease. As a lead in advocate of heart disease, this time we have expanded to developing policies or health modules for the lay or for the barangay health workers in Quezon City. Focus on success demonstrated by PNC because we have a strategy development. We have an ongoing strategy development. Our director is appointed by the hospital and aligned with the Department of Health. There is a different plan every 6 years. So now, dati nag-strategic planning every year without monitoring so that at the end of the year, makikita mo hindi mo pala nagawa. Then you make new strategies. But now, because there's a map, there's no need to have a strategy regularly every year. There's a need for refresh every 3 years. But most importantly, there should be a monitoring monthly within the unit, quarterly, which has to be reported to the EXECOM for action planning. The PHC supports the core values of valuing people by valuing performance accountability so that when the government says that bonuses will be dependent on performance, it was easy to implement based on the performance monitoring that occurs within the units. There has to be innovations that become opportunities. Initially, we had only a clinical pathway for the Z benefit. The Z benefit package was one of our most important program in 2013. In the Z benefit package, it means that the patients do not, if they are class D or if their income is less than 50,000, they can have a free operation of the more common open heart surgeries both for children and for adults. So we were confident we will be able to cascade that kasi meron kaming clinical pathway wherein if you say that the operation is done in 7 days, it will really be done in 7 days with very good outcomes. So with this, open heart surgery can be done when you used to spend about 700,000. It can be 0 or 100 to 150,000 if there is a co-payment for some patients. And this is our strength and what we really cascade in the regional heart hospitals. We teach them how to operate the more common open heart surgery so that eventually by cascading the Z benefit pathway, heart surgery can be free all over the country for the very important or most common causes of heart diseases or death. The PHC collaborates with the departments and organization by evidence-based care practices or research. And the most significant opportunities that we have is we are still the #1 hospital which is sought for by all our patients, and we need to increase our bed capacity. And by this, we now have an increase in bed capacity or new units. We have a new ER which was good for us so that we have 2 ERs during the COVID season. One was for COVID and one was for not. Because of the new expanded bed capacity, we had a way of delineating what is COVID and non-COVID because we had additional beds. But this was what I said earlier. Analysis was important for whatever implementation, and benchmarking was important. Benchmarking for our procedures in international procedures. Then PQA accreditation will also give you your key business factors. It is still the most important, still the only government hospital with international accreditation and the first in Asia to receive Diamond accreditation. And we are challenged to continue to be Diamond. It is the only hospital recognized in level 4 at the Institute of Solidarity Asia. And with this, we have trained other hospitals to go through strategy map and go through performance management. There are about 82 hospitals. We have cascaded to about 70 hospitals to go through drafting the strategy map, what they like their hospital to become. This was also the basis for universal health care, wherein the government gives you money for your strength as an institution. So we are now the apex. May identify the apex for different management, and the funding therefore of the government is strategized and placed at the strength of the hospital. Like we are the apex for universal healthcare in cardiovascular care. We are also awarded Excellence on Innovation Hospital Management in Nursing, Asian Hospital Management Award, and awarded Healthcare Asia Patient Care Initiative. Awarded the Most Outstanding Office for Association of Government Accountants. The Philippine Heart Center has satisfactory levels, and several results of societal responsible supported by key communities shows a sustained trends. There are now regions which have established their own heart centers. So vulnerabilities, they also give you your gaps in performance. We now benchmarking, two-way communication with the workforce, and strengthening the HR. So HR now has gone through development of strengthening the core and advancement. Ito yung sinasabi ko, akala mo level 3. Level 3 is 50 to 65. So each of the levels are rated by PQA. Sabi nila, we have to improve in product and processes, customer, financial, leadership and governance, and workforce. So far, after 3 years, we have now worked on our PSS, on our GOCC. We are now going to international accreditation. So as a result of this internally, since we had internal PHC virtual best practice recognition, so lahat ng initiatives of all the units, despite COVID, this was COVID time, March. So internally, because of the scoreboards, all of the entries were asked to submit their scoreboards, their best practice. And true enough, we were surprised to have 12 entries in the best practice. Because of that, we joined the International Best Practice Contest. We had 7 entries in the best practice, and this award, 10-year implementation review of this business excellence, was chosen to be a finalist among 7 entries. We had continued to have ACI accreditation despite COVID. In December 2020 to April 2021, the accreditation was shifted to virtual. So we went through virtual accreditation despite COVID, and we had very good results. We are still waiting for our face-to-face accreditation by next year. We continue to have ISO surveillance. According to ISO, we should have internal audit twice a year. So we had ISO surveillance last year, and now we are preparing for our reaccreditation in January of 2021. Beyond better is accreditation and governance excellence despite COVID. Dapat tatandaan natin, we have gone through a lot to beat COVID, and the only way to beat COVID is to apply our accreditation and governance excellence that we have learned in the past through the different accreditations. So thank you for your attention.
Thank you very much, Dr. Balderas, for your very engaging and comprehensive presentation. So now we move on to our question and answer portion of our webinar this afternoon. We would like to read the first question from Miss Minerva Maramag, and she is asking if we can also provide best practices to municipal health offices that the Philippine Heart Center is doing right now. So it's also a suggestion on what best practices the municipal health offices can do that the Philippine Heart Center has been doing and can be shared to them. So what can they do, or what can they emulate with your organization that they can apply with the MHO po?
Perfectly pwedeng gamitin sa municipal health office, the breakthroughs that were shared. Ang gagawin niyo po kasi, what is the objective of your office? So if the objective of the office is increase the number of people who are served, o kaya increase responsiveness to the community, then pwede nating i-measure yun. Like, kung ang reach of the municipal health is the whole community, magkakaroon kayo ng goal. By this time, ilan percent ang reach? 50%, 25%, and ano. Number 2, how is the initiative? Dapat yung initiative, kung ano ang gagawin nyo para the goal is attained. So usually sa municipal health will be implementation of programs ng municipal health can also be monitored, o kaya yung response of the people, and pinaka-common is increasing the number of the community who reach the municipal health. So I think in any area, pwede pong gamitin yung shinare namin na goal setting, and pwede din ng benchmarking ng lahat ng mga ang municipal health kasi, di ba, maraming rural health units that report to them. So, pwede kayong maglagay ng overall breakthrough for the whole rural health unit. And then, may tinatawag na cascading. So, kung lahat kayo, ng mga rural health, will implement what was cascaded, then the outcome will be greater. So, yun ang nami-measure. So, I think, in terms of advocacy sharing or advocacy implementation, maganda po yung sinabi natin, scoreboarding or benchmarking dun sa municipal health.
All right, very well said, ma'am. That's a good suggestion for the MHOs to do, especially in applying the best practices they learned with your presentation. So next question is about your journey on the QMS and PQA. So based on your experience, what challenges have you faced during the QMS audit and PQA assessment? So more or less you can share what are your different challenges that you have experienced or the journey that you had in achieving the certification and the award.
So I think the most common challenge is the acceptability of all the people going through different accreditation at a time. Sasabihin nila, yan na naman, di ba? Yan na naman, iba-iba. So there's a feeling of napapagod na sila. So what we did is you have to marry one accreditation with the other. So in the end, it enhances one accreditation with the other. Like example po, marrying the ISO accreditation. Yung ISO accreditation, meron siyang objectives, di ba? So, tapos yung breakthrough is 1 or 2 objective per unit. So, what we did is make the breakthrough the objective of the unit para yun na rin ang minomonitor niya. In that way, nasagot na namin yung question on ISO or yung QMS. Another is, yung sa form ng QMS is a good way of improving also monitoring. So, yung mga implementation. So, you make it the rule, which means lahat ng unit, ito dapat ang sundin. You make them understand na yung ginagawa nila sa isa is an improvement by using the other. And then, aside from acceptability, training cost. Yung training cost, pwedeng ikakascade nyo na lang. Like, we had a training in PQA. So, ikakascade na lang sa small unit. So, even if there's a core who undergoes training, ikakascade nyo sa lahat. Eventually, you find a need na lahat mag-train para uniform ang knowledge. And with that, the leadership will readily accept na kahit there's a cost involved because you made them realize na dapat yung uniformity. Everybody learns at the same time. Like in our ISO or QMS, everybody went through ISO retraining, mga data controller, on data management, and on management review. Sabay-sabay na nag-train. And then, di po, maganda po yung di naman sinasabing pinakamura. PQA has a high standard. Pero if you compare with the others, siya po ang pinakamura kasi parang 50,000 lang po dati ang aming bayad sa PQA. While entering the different accreditations is about 200 to 250,000. Eventually, napipick up na rin ng mga tao na that's important. So, they come to you, sila na rin nagpapacheck sa'yo without even asking. So that quality and excellence becomes a nature of everybody kasi napagdaanan yung lahat and everybody is happy with the results. Reporting of results is very important. Kailangan ini-inform mo sila na ito ang result of the book. So quarterly reporting, tsaka mid-year reporting, and giving a feedback to the management is very important for them to support whatever initiatives that each of the units have. So our way also is yun nga, we implemented yung best practice within the Heart Center, and those who want the best practice, yun na rin ang sinasama namin sa international. Enhancing one accreditation with the other for acceptability.
Thank you again for that answer. And we have another question from Ms. Virgin Dila. How is the employees or patients' rights to privacy is being ensured? And another follow-up question to that, how do you protect the patient's rights on privacy during accreditation? So that's their question.
I think that's very important yung sa patients' rights during accreditation. We have just written and gone through the training on Data Privacy Act during accreditation by making the accreditor. The accreditor should sign that anything which is discussed is within the limits of the hospital. I think it has to be in the contract that there's a data privacy. And then when you discuss the patients, umpisahan mo that we are observing the data privacy here, and this is the chart of the patient. However, ganun po. Those are the ways for us to safeguard the Data Privacy Act. So during accreditation, meron pong pinipirmahan yung accreditor. And going through, sasabihin mo Data Privacy Act is observed, is actually a plus point. And it is a different implementation. Yan pa po ang ini-implement namin ngayon to clean our files, lalo na because we have a lot of programs, we have a lot, especially during the pandemic, lahat electronic files and everything. So, meron pong assessment, Data Privacy Act assessment for all the programs that are existing in your unit. And meron pong format yun lahat. Iba pong Data Privacy Act assessment is also another requirement na kailangan natin under iba pang accreditation body. So, next year po yata i-implement na that all of the government institutions will be checked on DPA.
So again, thank you for that answer, ma'am. We also have another question from Ms. Josefina Lakay. In a multi-sectoral group consultation, how about the linkages in networking? Is it limited only to members or stakeholders staying in the Philippines?
We have not limited our networking within the Philippines. We have networking outside the Philippines, especially with sharing of best practice. In medicine kasi you share, exchange your treatment, ganyan, di ba? So, we did not limit our sharing with the Philippines to sa regional hospitals. There are foreigners who come to us and learn from our techniques on devices, on closing the congenital heart diseases. So, dito sila nag-aaral. So, I think, and then we join international conferences. So, we do not limit benchmarking with local only. And I think, if you are in the loop, for example, tayo, we now speak the same language on benchmarking, best practice, and the only way is international. And iba naman po ang level sa international. They are more advanced in technical. The advancement is greater than sa international. So, parang nasa baby steps pa tayo. But there is no way. We have to accept it also that going international is also a part of improvement. When you compare yourself with others, malalaman mo na, ay, hindi pa pala, marami pa akong gagawin. Ganun po. Thank you.
For our last question from Andrew de Los Angeles, he is asking, in the hospital setting, how do you collect or measure customer satisfaction from a sick patient or from a cured or healed patient? For the last question.
Patient satisfaction is way in the hospital before they are discharged for cured patients. We have uniform patient satisfaction form. And for those who are not cured, we have a complaint form or meron kaming reporting form. You do not learn only from usually yung satisfaction at the end. Ngayon, uso na sa amin yung report form. But you scan, tapos merong incident report form, voluntary reporting. You voluntary report something that does not happen well because not to blame, but because it is a way of reviewing your policy and implementing new policies. Dun mo nasasagot ang gaps. So kahit na may complaint, those are the gaps that you have to answer. So those are the mga perfection na kala mo because sabi nga natin, this is a perfection is a work in progress in excellence and governance. So not only those who are happy, pero pati yung mga nagko-complain, i-embrace mo.
So I think that's only the time we have today, and you have very well answered all of our questions from our viewers this afternoon, Dr. Balderas. So thank you very much for taking time with us. I think you're very busy right now, especially during this pandemic, and we really appreciate you sharing all of your best practices, especially in providing good quality healthcare for the Filipinos, also sharing it through a wider audience through our webinar. Thank you po, ma'am. And to all of our participants, please don't forget to accomplish the evaluation form through the link posted on the chat box. So it's posted right now. And on behalf of the Academy, I would like to thank everyone for watching. We hope that you learned a lot from this session, and see you again next month for our next webinar series only here on the Public Sector Productivity webisodes. Thank you, and we hope to see you again on the next session.